and everybody that got early treatment stayed out of the hospital. But the first thing I did was dug into the safety, and anybody could do that, which is a minimal amount of effort. You can go to the FDA website and you can find the toxicity data on ivermectin. And there's something called the LD50, lethal dose 50, which is it's a benchmark number that gives you an idea of how toxic a medication is. And LD50 means how many what dose would kill 50% of lab animals. So for ivermectin, it kind of depends on the type of animal and the gender. But it's basically 10 milligrams per kilogram up to 80 milligrams per kilogram. So for COVID, we're using 0.4 milligrams per kilogram. So I knew that we were not worried about killing people with it. And then I did a literature search, and I looked for accidental, intentional overdoses for ivermectin, and I couldn't find a single study. Whereas you do that for Tylenol, thousands of reports. So once I knew it was safe, then I started using it, and then I found it worked. And then, all in all, I treated well over 6,000 patients, and everybody that got early treatment stayed out of the hospital. I also had patients come in that were really sick in the second week, and that was such a learning experience for me because normally if somebody walked into my office with an oxygen saturation in the low 80s, I would call an ambulance. But I had patients who were refusing to go to the hospital, and I had to give them the option to possibly die in my office, which is scary. But we saved them. We just threw the kitchen sink at them, and we didn't have monoclonal antibodies. So we brought them in every day. We did IV steroids. We did IV antibiotics. We gave them home oxygen. We gave them high dose of ivermectin. We did everything we could, and it was amazing. They survived. It was very gratifying.